Dr. Maria Doucet. Welcome to my office as we have our little discussion today about dizziness. So grab a cup of coffee and join us. We're going to give you some information about dizziness. Dizziness is something that many of us do experience at some point in our lives. And it's something that if it comes on quickly or it comes on unexpectedly, it often can be debilitating. So we just wanted to have a little conversation about what are the things that we do as an ENT physician to treat dizziness. And I have with me today one of my friends and colleagues, Expadie Laperouse, who is a physical therapist who does specialize in vestibular rehab. So we often work together getting many patients through the process of feeling better from dizziness. As we mentioned earlier, dizziness usually comes from an imbalance in many parts of your body. The things that maintain your balance are your vision, your inner ear, the cerebellum of your brain, your feet, your proprioception. But by far the most common thing that causes dizziness is BPPV. It's a little bit difficult to explain to patients what's happening physiologically on the inside of the ear when we're trying to describe where the problem is coming from. So I'm going to use this little ear model to see if I can make it any simpler. So if we look at the model, this is the external ear, and this is about where the eardrum would sit. So deep on the inside of the ear is this structure, the structure that we would consider simply the inner ear. So if I take this inner ear out, just for the sake of using it for the demonstration of what happens when we get dizzy, we can see that in the inner ear, there are these three canals, and we have a posterior canal, a superior canal, and a horizontal canal. These canals are usually filled with fluid, such that when you move your head in a certain position, the fluid moves in a certain direction. When you move your head in another position, the fluid moves in another direction. And one of the ways that your brain senses the movement of fluid through these semicircular canals is another section called the utricle or the saccule, contain hair cells that move and bend as the fluid moves, and a gelatinous matrix, and on top of that sits these little crystals or otoliths, but we call them crystals just to make it a little bit simpler for people to understand. And sometimes what happens is when you lay down at night, the crystals come out of the section that they're supposed to be in, and they get into these canals. And so that's why often people will say that the dizziness is worse if they move their head forward, or if they look up, or if they're moving head from side to side, or even just turning over in bed, can cause the room to start to spin. It's really considered a hallucination of movement because you're not moving. It's the fluid on the inner ear that's moving, even though the movement that you made may have been very slight. So once the crystal gets into these canals where it's not supposed to be, it's difficult to stop the movement because the slightest movement will cause the canal to start spinning again. So some of the demonstrations that Expadie gave for us today talk about what positions we can get you in to get the crystal moved out of the semicircular canal and back into the compartment that it's really supposed to be in. And this little compartment that normally houses those crystals turn around in that compartment all the time. So it is not infrequent that you get BPPV and we get you treated, we get your symptoms improved, and then the symptoms come back. So we're just trying to get some information out about the process of having this worked up, some of the treatments that you can do on your own. But certainly I've seen many patients who try to reposition themselves and make the situation worse because they're either doing the wrong maneuver or they're moving it from one canal to the next. So I always say it's best to start with an evaluation, first of all, so that we can make sure that it is BPPV or look for any other causes of dizziness, but second of all, so that we could advise you on which canal that we think is involved so that you can participate in the most proper treatment. So from an ENT perspective, dizziness is one of the most common things that, from our perspective, occurs in the ear. And so when patients come to us, it is our job to determine if the dizziness is coming from the ear. Is there an ear infection? Is there fluid in the ear? Is it the inner ear? And there's many things that can cause dizziness. Cardiac issues, pulmonary and oxygenation issues, anemia, many things. But the most common thing that causes dizziness is a condition called benign paroxysmal positional vertigo, or BPPV, and that's really what the focus of our talk is going to be today. So typically patients are sleeping at night, roll over, wake up with their room spinning. They come to see me. We look for obvious things on exam like fluid in the ear and so forth. But then typically the focus becomes, how do we stop the dizziness and how do we control the BPPV? And so that's when we involve our colleagues that specialize in vestibular rehabilitation and some procedures and maneuvers to treat the source of the dizziness as opposed to just treating the symptoms. So I'm going to let Expedie take us from here and what happens when the patient gets to his office and how we can get you feeling better.
Hello, I'm Expedie Laperouse. I just go by X, and I'm actually an occupational therapist, but I've been with the Physical Therapy Clinic of Lafayette for 25 years, and I've been doing vestibular rehab for the last 5 years. Some of the alarming statistics that we've seen with falls is that 1 in every 3 adults age 65 and older will have a fall each year. So that was alarming. So as we were treating a lot of basic balance problems, we noticed that vestibular was a primary symptom. So we did more training, and that's where we've come. BPPV is said to be 30% of the reason why those 65 and older people fall. So here we are. So when a patient comes to my office, I look at several things. First off, I watch how they walk to the room, if they're with someone, if they drove there. So once they're in the room, I look at several little issues. One, I look at their posture. I look at their temperament, if they are nauseated, if they are in constant vertigo. I look at their sensation. Sensation to the feet is really important. If a person has neuropathy of what forth, then they might not be steady with their gait or balance. And then I do several tests to determine the level of their vestibular issues. And amongst these tests, I'll do what's called the Dix-Hallpike maneuver. And what the Dix-Hallpike maneuver does is it tests, there's 3 semicircular canals in your ear, and it tests to see what canal is involved. And what happens with BPPV is they have these little small crystals that float into these little canals. And by putting your head in a certain position, we can see what canal is involved with the BPPV. The reason that's important is because that determines what repositioning techniques we do to try to reposition that crystal back into its proper place. So it's a simple maneuvers that we do. I also test your eye coordination exercises and see how you do with those. But once I can determine what canal it's in, we usually do the repositioning technique right then and there. Majority of the time, it takes 1 or 2 techniques to reposition the crystal, and the patient feels absolutely fine. Sometimes it's stubborn, takes a little longer, but the majority of what I do is do the repositioning and train the patient and train the caregivers on how to perform this maneuver at home and show them what activities not to do to prevent this from happening again.
So I remember the first, when you have patients come in and you say, I think your crystals are off. You know, at first you get a look like, okay, I'm not sure what this kind of situation is. But these crystals are meant to be in the ear. They are part of the balance organ, but they're meant to be in a separate compartment. And sometimes we don't know really what causes them to move out of the compartment that they're supposed to be in. But once they get into the semicircular canal, it does cause the dizziness. And I think many people either wind up going to the emergency room where they use medications to treat the symptoms, and as soon as they stop the medications to treat the symptoms, the problem comes back. And so that's where we step in to try to get the problem definitively resolved. So once you've had an evaluation and you've had the repositioning, it is often very beneficial to have some knowledge about what you can do to treat yourself or your caregivers can do to treat you if it comes back and in the middle of the night or over the weekend, or at least until you can get back in. So our next little clip is going to be a demonstration on how you can do the positioning yourself.
Hi, my name is Expadie Laperouse. I'm an occupational therapist with the Physical Therapy Clinic of Lafayette. And the purpose of this video is to help patients who are experiencing vertigo symptoms to perform a maneuver that could help alleviate these symptoms. Vertigo is also called BPPV, and there's 3 different canals that this can be affected with some inner ear issues. What we're going to do is show you how to alleviate the posterior canal, which affects 80% of all patients with BPPV. So I'm going to go through the techniques and explain to you each position and why we're doing it. These techniques are to be done at a 30-second hold on each little position. And the reason for that is when the crystal drops into the canal, we have to allow a certain amount of time for the crystal to continue to drop. Then we rotate it so the crystal goes even further until it goes in its proper place. The hold time is 30 seconds to 60 seconds. We expect you to experience some symptoms, but they should go away within 10 seconds. But we still need you to hold or maintain that position for at least 30 seconds. The first position is, you can see, Royce here is tall kneeling. He's going to get on his knees, and then he's going to drop to his hands and his knees. And then he's going to lift his head up. So this is the first position you're going to maintain for the 30 seconds. This allows the crystal to drop into the canal properly. You may experience some symptoms, but please maintain it for 30 seconds. So after 30 seconds is up, Royce is going to drop his head all the way down to the ground, and he's going to tuck his chin to his chest. He's going to maintain this position for, again, 30 seconds. Now the next position is he's going to rotate his head to the side you're more affected on. Most people, if they're sleeping on a side, they wake up and that's the side that's causing the dizziness. If they turn to the other side and it doesn't have any symptoms, then you don't need to do this to that side. So for Royce's symptom, we're going to turn to the right side, and what he's going to do is he's going to position his head toward his elbow. He turns it at a 45-degree angle, and he maintains that again for 30 seconds. After that time is up, he's going to come back to this position. He's going to hold his head to the side again for that 30 seconds. When that is up, he comes up, still turns his head to the side, and your symptoms should be reduced, if not gone away. So the first thing you will have to do is sit on a bed or a table, and you want to long sit and sit straight up. Now the direction you're going to turn your head depends on the direction that you're having symptoms. If you're sleeping on your right side and you wake up and you're dizzy, then you know it's your right side. If you turn to your left side and you get dizzy, then you know it's your left side. So for this testing, Royce here will be demonstrating the right-sided treatment for this maneuver called the Expadie maneuver. What Royce will do is he's going to turn his head 45 degrees. Okay, that's not completely looking at the shoulder. That's halfway between looking straight and the shoulder. And he's going to come back down. Now I have a pillow here that's going to offer him time to extend his head. You want to extend your head about 20 or 30 degrees. He's going to maintain this position for 30 seconds. The reason for doing this is it takes time for the crystal to drop down into this canal. These canals are semicircular shaped, and so we have to do certain maneuvers for the crystal to keep falling down into the canal. You want to maintain this position for 30 seconds. You may experience some symptoms of vertigo, of dizziness, or lightheadedness, or even nausea, but they should subside after about 10 seconds. After the 30 seconds is up, Royce is going to turn his head to the left side, and he's going to hold it at that 45-degree angle again. Again, this is the position halfway between looking at the shoulder and looking straight up. Royce is going to hold this position for 30 seconds. And then when that is up, he's going to turn on his left side. And this is important. You want to turn your head to where you're looking to the ground. You want to hold that position again for 30 seconds. Most people will experience symptoms of vertigo in this position. After 30 seconds is up, then you're going to sit up but still maintain your head looking to the side. And this is the final position. You're going to maintain this position for 30 seconds again. Your symptoms should be reduced in this position. Now I'm going to recommend that you do this technique 2 or 3 times until the symptoms resolve. If again after 2 or 3 days you do not have any relief, please contact your physician. Thank you.
Thank you so much, Expadie, for that excellent demonstration on how to reposition your ear if you are having symptoms of dizziness. So please let us know if you're suffering from dizziness, especially if it's worse with head movements. We can definitely get you feeling better. Thank you for joining us today.